An epidemic of addiction to opioids swept the nation and claimed thousands of lives in the Commonwealth of Virginia in 2016. WDVM's Kiana Deiches tells us how a local doctor is using a fairly new treatment to lower his patients' risk of addiction.
Every day, more than 115 people die from the opioid epidemic. Many affected originally got started from prescription opioids like those given after major surgery.
One day after gym class, something was clearly wrong and it got worse and worse. The next day, I was in such pain I could only walk at a 90-degree angle.
Earlier this month, Ann Grunner had spinal surgery to remove a herniated disc.
As opposed to a typical disc herniation that most people have is more in the central part of the spinal tunnel. Hers was actually on the lateral foot on the outside.
Typical spinal procedures usually require standard microsurgery, but Dr. J. Lim took a different approach and performed a spinal endoscopy.
What people really want is really a minimally invasive surgery. We're talking about a little stab incision with no dissection involved.
His approach to surgery also lowers the risk of opioid addiction by managing pain after surgery without prescribing potentially harmful drugs. It's a treatment known as enhanced recovery after surgery, or ERAS for short.
It's just a number of things that we do that makes people feel better after surgery.
Things such as treating the problem with a combination of non-addictive medications.
Not just narcotics. They get Tylenol, which also acts in a different way. And so all those things sort of prime the body so that they have less pain after surgery. I was probably prescribing 30, 40, 50 narcotic pills at a time at discharge when they get home, and a lot of times they would need refills. Now we give them 6, and most of the time people don't even use that.
Prior to the surgery, I was taking some opioids at night because it just hurt so much. Post-operatively, no opioids.
Reporting in Reston, Kiana Deiches, WDVM 25.
And E.R.A.S was popularized by doctors in Europe.